And we should be live. Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have a very exciting session with Dr. Alger. Dr. Alger, thank you so much for joining. And on that note, the floor is yours to take away.
Cool. Okay. Hi, everyone. Thanks for joining. I was asked to give a little presentation about my experience as a dentist. So I put together some slides with just a lot of photos. I'll share my experience. I'll share a couple cases. If you guys have any questions, just please stop. I'm supposed to be on this YouTube live thing, but I can't see it. So if you guys just want to tell me if there's questions that come up, you can interrupt me.
Okay, for sure.
Oh. So just to introduce myself, I go by Katie. So you don't have to call me Dr. Alger, just call me Katie. I currently live in Philadelphia, but I'm actually in Miami. I took a couple of days off, so I'm visiting my best friend down here, and it's amazing. I grew up in Albany, New York, but I moved around a ton, so I don't have the Philly accent. I'm left-handed, which I guess is an interesting fact, especially for anyone considering dentistry. So you don't realize until you go to dental school, everything is set up for right-handed people. So you have to make sure when you're touring dental schools, make sure you can get a lefty chair. Otherwise, your world is going to be difficult in dental school. And because I'm left-handed, I think it's one of the reasons I started a practice sooner in life, because I wanted to be comfortable at work. That being said, I did open my own practice in June of last year, which was crazy timing. I signed a lease literally the week before COVID hit America. So like end of February 2020, I signed a 5-year lease. It was crazy, it was exciting, but it's worked out beyond what I could have imagined. I love being a practice owner, so we'll get into that a little bit. But just to highlight some other factoids, I guess I went to undergrad at Penn. I went to dental school at Columbia. I've loved them both. So if anyone has questions about either school, feel free to reach out to me after the fact. And some highlights, I love to water ski. I'm a little bit of an adrenaline junkie. So if anyone wants to talk about extreme sports, I'm down for that too. And the bottom left photo, I just went to Hawaii with my best friend. It was a great trip. I have awesome recommendations. So also feel free to talk to me about that. I figured I would put the advice in the beginning before you guys really fade, because no one really pays attention to these things. But if I could go back and redo college or like be where you guys are now, I guess I would just tell you to really enjoy it. Have fun. Don't worry too much. Everything kind of works itself out. You'll get where you need to go. But this is the one time in life where you have nothing to do but learn. So I think if you focus on learning and enjoy it for what it is beyond just getting a good grade, like you'll enjoy it so much more. Another thing, go to office hours. Professors are smart people and they're there to help you, so definitely take advantage of them. They have a lot to talk about. They're super interesting if you find the right one, and you need them for letters of recommendation. So start building the relationships early, because you need to ask for letters of rec by like 3rd year, I guess, right? And then one thing I wish I learned earlier in life, like don't worry what other people think about you. Just own who you are and you'll live so much more carefree. All right, so going through, I guess, my journey, the reason I became a dentist is because of this lady on the left-hand side. That's my mom. So she was super phobic of the dentist, and I had to drive her to get a tooth extracted one day. She was doped up on Xanax, and I watched her get the tooth extracted, and I was like, yo, this is so cool. This is like a video game. So that's when I switched from pre-med to pre-dental and didn't look back. Went to Columbia, absolutely loved it. I met the most amazing people there, have like such good friendships from dental school. And then I went to residency, which is the second column of photos. I did a 1-year GPR at Northwell Health. And then at the end of that year, I applied to stay for an implant fellowship. So I ended up getting selected for that. I did an additional 2 years, which was amazing, because it was like a mini pros / heavy surgery program. So I learned a ton. So it was 3 years of residency total. And then if we get to the third stack of photos. After residency, I worked as an associate dentist for 3 years. I worked on Long Island for a year and enjoyed that. But then I got a job offer in Pennsylvania with my mentor, who actually is the one who extracted my mom's tooth way back in the day. And he hired me to work for a set of group practices where I actually drove around between them and placed implants. So the bottom picture here of me holding the cake is one of the dentists I got to work with. He would restore all the implants I placed. And it was amazing being able to work with so many dentists because I would pull like little pieces of learning from everybody. Like you never stop learning as a dentist. And so that was huge. Like I loved working with other dentists. But ultimately, my mentor sold the set of group practices to a private equity group. And they came in and they changed a bunch of things. So I wasn't super happy with where things were going. And I interviewed for a couple of jobs and then ultimately decided I just wanted to work for myself and practice how I wanted to practice. So on the right, you'll see I opened my own practice. It's called Dice Dental. It's a horrible name, but it's an acronym and it stands for dentures, implants, crowns, and extractions. So it's the 4 things I do, and that's the only things that I do. It's honestly been such a good decision. So I guess I'm a general dentist, but I don't necessarily practice like one. But I kept the slide in because theoretically I can't call myself a specialist, even though I did implant training. But we kind of touched on my business model. So I just do 4 things, like I said, and I do them for below market value, which is kind of crazy. So I'm super busy just doing a ton of surgery and a ton of like full mouth rehabs almost. But I've never been happier. I basically decided to run like a lean and mean model. So I don't have a hygienist. I'm not like running around doing hygiene checks. I'm not super busy. I just get to sit and focus on a couple patients a day and just do a ton of work on all of them. So I guess that's the cool thing about general dentistry. So technically I'm a general dentist and you can really do anything that you want with it. You can be a clinician, you can work for someone as an associate, which I did for a couple years. You can own your own practice. You can start hiring more people so that you can take off and go to Miami like I am. Or you can go non-clinical setting too. So you can buy up a bunch of practices and manage them, or you can teach, which is something I'd ultimately like to do in the future. But I guess you have the option of going general or you can specialize, right? One of the reasons I didn't specialize is because it's like a ton of money. So no one really talks about this when you're in dental school, but like on top of paying for dental school, you then have to pay for specialty training in a lot of instances. So going to ortho is like another 100 grand per year and it can be 3 years. So I just didn't want like that extra debt burden. I don't regret it at all. I was paid pretty well in residency the whole 3 years. So after dental school, like I was making money right away instead of going into more debt. And that's definitely something that you guys should all consider. And then on the right here is just pictures of my practice. Okay, so general dentists do a ton of stuff, fillings, hygiene checks. I don't do those, like I said. I just do the 4 things listed on the bottom of the screen. So I do a ton of dentures, which sounds like no one wants to do dentures, right? But I love them because they can transform someone's mouth and smile and like whole face. So it's actually been really cool. I love doing dentures. It sounds so nerdy, but when you get to dental school, you might enjoy them if you give them a chance. I do a ton of implants. I do guided surgery. So I have a 3D printer. And so you can see this x-ray, like they're all very parallel. I did not do that freehand. I cheated with a computer system, but you can do that with technology. And then the crowns that you see over here, I actually have a milling machine in my office. So we make all of our crowns in-house, which is super cool. It helps cost save. And so that's why I can charge less for the services I provide. So again, this is just examples of like some of the stuff that has walked into my office in the last year. On the left, we have an upper denture. on the bottom picture. And then we have an implant bridge down there. There's a mix of crown and implants, a bunch of crowns, and then some implants to fill out the smile that you see on the right. Okay. So I can't really say that I have a typical day. One of the nice things about being a general dentist is that you have so much variety in your schedule. Even though I only do 4 things, I end up being like, I don't know, you have to get so creative, and there's so many things that you do beyond just those 4. Like, you meet people, you do procedures, you do surgery, you do pros, like there's no typical day. It's never boring. So that's one good thing. The bad thing is that there's no sick days. So I don't think I've ever called out sick. I did have to take off the day after my second vaccine dose because I just felt real weird. But that's a bummer about dentistry that you guys should keep in mind. Another thing is it's super, super hard on your body. So I recommend getting monthly massages and start doing yoga now. Some patients are soul suckers. So you're going to have difficult patient management cases. It's stressful, it's mentally exhausting, but at the end of the day, there's so much good stuff too. So what I love is, like, I go home and I can see what I did for the day, and it's just so tangible, right? Like, you'll go home and you're like, oh, that felt good today. I changed this person's smile. So that's a huge part of dentistry and why I chose to do it. There's also just so many appreciative patients. Like, it feels really good when you can change someone's life. You can start gifting patients treatment, especially if you own your own practice. And I don't know, it's just a great profession to be in, I think. Let's see. Oh, so some of my pictures are missing from this slide, but this is more examples of just patients who have walked in over the last year. I get all sorts of complaints from people. So you can see, like, some people, I don't know how they get to this point, but they end up in my chair and it's like a judgment-free zone. If there's any weird, wild complaint, I've definitely heard it. But we just deal with it. We come up with a plan and we move on. Okay, so for me as a general dentist, the biggest thing that's probably the most important is me just talking to the patient in the consult. I make all of my consults a full hour because there's so much that you have to go over. Again, I don't have the typical patient coming in and just needing a bunch of fillings. I have patients who come in, I mean, you saw the pictures on the last slide, like, they need their full mouth basically redone. So we have to sit down and figure out, first of all, like, how did you get here? Why do you have all this decay? Is it because you were drinking sugar in your drinks and you didn't realize it? Is it because you have a dry mouth because of medication? If we have to take out all of your teeth, what are you expecting me to give you instead? Like, you already lost your first set and you're X years old. I have to give you a second set, which is not going to be as good. So, like, do you understand that? Do you get the shortcomings that we have? So it's a lot of conversation back and forth. And as much as I'm interviewing them, they're interviewing me to make sure that, like, I'm the girl that should treat them. And I kind of just lay it all out there, and I'll like straight up tell someone, like, dude, you're screwed. Like, we have option A, B, and C. Option A sucks the least. Option C sucks the most. But when you're honest and you have these, like, candid conversations with people, it seems to really translate quite well, at least where I practice. So again, patient history, the consult is probably the most important diagnostic test, because I can sit there and tell them, like, okay, this tooth needs XYZ, but a lot of times it's deeper than that. And there is a conversation that needs to be had about what's most important to them. And then you kind of help them in the direction of where they need to go as far as which treatment option to choose. And then another thing, I use 3D imaging in my office. So I have my own cone beam, and it's been a game changer. you can't really see much on the 2D x-rays that they always take for cavity detection at the dentist when you guys go. I mean, you can see cavities and stuff, but when you're talking like full mouth rehab and needing implants or you have infection, you see so much more on 3D imaging. So hopefully by the time you guys get to dental school, that is a lot more prevalent, because it wasn't until after school that, and even after residency, that I got into so much 3D imaging. Any questions so far? I can't see if there's questions, so I guess not.
There's a one question. Do you want to like do it now or at the end of the session?
Doesn't matter.
Okay. So can you talk about how you were able to do an implant fellowship?
Yes, so it just was because of the program that I went to. So I matched at Northwell for the GPR. And as far as I know, they're one of the only programs that has an implant fellowship, but they only would take residents from their program. So I think there was 20 of us GPRs as a first year, and maybe like 12 of us applied to stay, and there's 2 spots. So I just got really lucky.
I see. Thank you.
Okay, technology and dentistry. I set up my office to have a bunch of tech. I love it. It makes my job easier. There's a little bit of a wow factor for sure with patients. So on the left, I have a 3D printer. I can 3D print temporaries for implants. So that upper left, that guy was missing 4 front teeth. That's just a temp we printed and put on 2 implants. I have the cone beam, which is the 3D imaging. Can you guys see my mouse?
Yeah, I can see moving.
Okay. I have digital impression capability, which is really cool, though it sometimes slows me down. So we're working on that. I said earlier I have a milling machine, so we actually make crowns in-house. An interesting fact, when they come out of when they get milled, they come out really big and chalky like this. And then you put them in an oven and they shrink down and turn the correct shade, which is crazy. One thing that it's still lagging, we can't do digital impressions with dentures because there's some compressibility to soft tissue. And so as far as we know, we'll always be taking like the goopy impressions for dentures, which kind of sucks. So floss your teeth.
Is there like a certain like what material do you like would you rather use for like these cases, like zirconia or porcelain?
It depends. So if I have like a beefy linebacker who doesn't really care about aesthetics, we're going to use zirconia because it's strong.
Right.
I do use a lot of zirconia in my office because you can mill it out of a puck. And so you get way more crowns per puck than you do with like Emax or stacking porcelain. So I do a ton of zirconia in my office. If I want something a little more aesthetic, I'll actually send out to an outside lab, but then I'll upcharge the lab fee.
Okay,
So
that
I'm
makes sense.
doing zirconia in my office just because I have my crown fee is really low.
Yeah, here zirconia is like one of the strongest ones.
Mm-hmm. Yeah. Okay, so I have a couple cases. I pulled these from photos that I took in residency. One, because I don't want current patients to Google me and see their teeth like all over YouTube. And 2, I just have more surgery photos from residency. I don't stop and take photos mid-surgery at this point. So I just have more interesting stuff that I can talk about, I guess, from this. So I'll go through 3 cases. This is the first one. This patient is very near and dear to me. She's lovely. But this, okay, so we have her x-rays. She was 28 when I first met her, and she had these bulky veneers that were done from teeth numbers 6 through 11, and they were done when she was 18, so they were 10 years old. And you guys can see that she's got some redness up here. If you look at the back of the teeth, you can see that there's like overhang of these things in between the teeth. And that's because she had smaller teeth. And instead of getting braces, they just put these, they're called lumineers on the teeth. She couldn't clean properly around them. So she ended up getting all this buildup and all this stuff stuck underneath the gums. And we didn't like the shape, we didn't like the color. So our plan was to do gum surgery, or clean up the gums at least, and then redo the veneers once the gums were stabilized. So in the top photo here, you can see like all that schmutz stuck underneath. I did a deep cleaning on her, which is just you get them numb and you like blast stuff from underneath the gum, but she still had pocketing and inflammation. So then we stepped it up and I did open flap debridement on her, which just means you get them numb, you peel back the gums, and then you have visual access and physical access to actually clean the root surfaces of the teeth. And then you put the gums back together and they usually shrink back a ton. So that is this picture. So this was immediate post-op. I used silk sutures, which is why they're black here. She came back for 1 week post-op. She was looking pretty good, but as we knew she was gonna shrink back, I had prepared her for this. But this was, I think, week 6, and this photo over here. So it's not like such a cute look, but we cleaned it up, you'll see. And you guys can see the junction of where these lumineers hit and just kind of how bulky they are. So you can imagine that they're difficult to clean.
Is the shrinking just due to like the healing process?
Mm-hmm.
Okay.
Yeah, it's anytime you like flap the gum open and put it back, you're gonna get some shrinkage. And then she also had bone loss. So the gums follow the bone.
That makes sense.
Yeah. Okay, so I ended up doing this case with an attending, and I took impressions on her. This was her original veneers, how they looked, and then I kind of cut them back in stone and tracked where her gums had shrunk to. And then we reshaped something a little bit more natural looking. And instead of 6 teeth, we decided to do 8, because a lot of times if you just do the front 6, you kind of lose the back of the smile and it just doesn't look quite as good. So if I'm ever doing veneers or an aesthetic case on someone, I'll tell them, look, we're either gonna do 4, 8, or 10 teeth. I don't recommend doing 6 because it just doesn't work very well, in my opinion. Okay, so once her gums were healed, we ended up cutting off her lumineers, and we were gonna switch a couple of things. We had to move her midline. So that's why the teeth underneath look really small. And the other thing is we wanted the crowns to just naturally come out of the gum. So that's the other reason why we prepped a little bit more than we maybe otherwise would. This is her in her temporaries. So over that wax, I took an impression of the wax that we had built up, and then you transfer that to the mouth with impression material in it, and you just trim it up. And they go home and they wear these temporaries for however long until the lab is done making the final veneers or crowns. So this is the upper view, or occlusal view, and you can see it looks just like a lot easier to clean than her old ones were. There's not a ton of bulkiness. They are connected, so she had to get like a floss threader underneath. But again, the gum health is so much better. Everything's looking good. When they first came back from the lab, so I took an impression and then like had a mock-up of what I wanted. They were a little bit off. So they had black triangles. And so basically you just have to tell the lab like, okay, first try was good, but not perfect. So this is what I want to change for the second try-in. So I needed them to add a little bit of material here and here and here, but the color was good. The inside edge position was good. So I sent it back and then we inserted, and this is how she looked. Still a little bit uneven, but it almost looks more natural that way. This was her full smile after the fact. And then this is just kind of the progression of like after the first deep cleaning, after the gum surgery, and then the full smile after the fact. So we brought everything up and the teeth are now longer, which makes them look a little less bulky. She was super happy with it. And You can see the photo of just her smile, but if you see the photo of her full face, it really is transformative. And that's what's really cool about dentistry. Like you can focus on the teeth, but the way it changes their whole demeanor is it's like something you can't really explain it until you see it. All right. Any questions on that one?
I don't see any questions on the case, but maybe at the end
Okay, cool.
someone will bring it up.
Okay, case number 2. This was another patient who I love. She's the best. Another one from residency. This was a couple years ago. But she had come in, I think she lived in Atlanta for many years and got a lot of dental work done in Atlanta, which nothing wrong with that, right? But it had been, I don't know, 5-10 years since she followed up with someone. And she came in with all these bridges in her back teeth that were just like totally broken. These were hanging on to just root tips. She could take these upper bridges like in and out. So she was kind of a mess. We went back and forth about should we take out all the teeth? Should we save the front teeth because they have nice long roots? And ultimately we decided to save the front teeth, take out her upper back teeth, and give her implants to chew with because she didn't want to wear anything removable long term. You can see kind of in the bottom photo here just how bulky those crowns were. So anything that's bulky is just hard to clean. We ended up taking the bottom teeth out too, but I think we'll get to that. Okay, let me go back. So one thing that happens when you place implants on the upper jaw, you always try to avoid the sinus. The sinus ends up dipping down in between the tooth roots, and it dips down when you lose teeth. So you have to put an implant in bone, and if the sinus invades that bone, sometimes you have to lift the sinus. So I'm going to go through some photos of us doing a sinus lift. We ended up doing it on both sides, but I just have pictures from the right here. So you get the patient super numb. You end up making a pretty large incision in the gum, and you pull the gum back fairly far. You make a little hole in the bone, and then you remove that piece of bone, and you're left with this little membrane. And then the membrane's almost like the inner of a hard-boiled egg. It's very easily ripped in some patients, and so in her case, we did rip the membrane as we tried to release it off the bone. And the idea is you lift the membrane and then make an airspace in the sinus and pack bone in between the floor of the sinus and where you lift that membrane to. So you can get more bone height to place an implant. Does that make sense? Hopefully.
Like more bone to place the implant.
Yeah.
Okay.
Okay, so we had this tear here. We ended up rolling up a membrane and putting it in, and then we packed it with bone. So you pack that whole area with bone, and then we put another membrane over top, and then you stitch it all up. So this was her x-ray immediately after the sinus lift on the upper right. You can see how much denser that looked, how it's white. That's all bone that we gained by doing the surgery. So we sent her home. You have to let that bone heal for like 4 to 6 months before you can place an implant in it. Sometimes you can place an implant the same day, depending on certain things. But in this case, we sent her home. And then we took a 3D scan at probably 4 or 6 months. And so we had all this bone to work with. We planned to place 3 implants on her upper right and give her 4 teeth on those 3 implants, 2 on her upper left. And I think we ended up doing some on the bottom too. Yeah, so at some point, oh yeah, I think they're in this photo, but like not in the slice. So yeah, down here, I placed 2 implants down there, let them heal. And because we were waiting for everything to heal at different times, and because she wanted back teeth to chew, we wanted to do all the final crowns at once. But because of the weird healing time, I told her I'd give her these temporary bridges so she could chew with them. So this was, and I wouldn't necessarily do this anymore. This is so much work, but this was what residency was for, and you learn a ton doing this. So I made her these temporary bridges by putting these like temp cylinders on top of the implants. They get screwed in. And then you make this little shell that's like the shape of a bridge. Make sure you can get it over those temp cylinders, and then you backfill and pick up with acrylic and make this all one piece. I don't know if there's a good photo of that. Yeah. But it ends up looking something like this, which is kind of cool. They can chew with it, and it helps shape the gum too. So you can see on the x-ray down here, like those are the temp cylinders hanging out on top of the implants. And then the kind of light is the acrylic. That's how that shows up on x-rays. So at this point, her lower right's healed. I probably placed her upper right implants this day, and maybe her upper left and her lower right left. I don't remember the sequence, but it's kind of just how you do things, I guess. Just whenever they're done healing. Uh-oh.
We actually got a question about the case, and it's saying, is an infection a big worry on this case?
Yeah, but that's kind of why we phased it. So she had infection to begin with her teeth in, because they were all like, her bridges were coming in and out. There was bacteria all over. So that's why I extracted the teeth first, let her heal, then did the sinus lift, let her heal. And she's on pre and post-op antibiotics at this, for all these big surgeries. Then place the implants, let her heal. But with implants, like, I don't know, we do them all the time. I really only give a loading dose for a single implant now, and I don't have problems with infection usually, knock on wood.
And the sinus lift, is that something that you see like with most implant cases, or is that just like with a specific person?
It happens with a lot of people, but I don't do that kind of sinus lift anymore in my practice. I'll send that one to the oral surgeon. I'll do like a mini sinus lift in my practice. But it's just, you do worry about infection with these cases, especially if you tear the membrane, if the patient has sinus issues. So that's why I don't do those as much anymore, but it's cool that I know how to do them.
Right.
Oh, here we go. I don't know why I lost a slide or two in here, but all right, at some point she has, all her implants are healed. We make her temporaries everywhere to work out her back teeth and how they're touching. This is her temporaries over here. The color's a little bit off, but you can see the right side, like that's meeting well. The left side, I think she was still healing by the time I left residency, so I don't have a final photo there. But one thing that's really cool is when you take impressions of these things, if you have the temporaries in the mouth, it means that the gum is basically formed to the temporary how you want it. And so you can put your temporaries on your stone model and then put this like jelly material around it that sets and acts like gum tissue. And then the lab will make your permanent crown to fit exactly like the temporary if you do it this way. They'll end up getting less food stuck, which is great. And you can see kind of how the tissue is shaped. And so the crowns come nicely out of the gum tissue if you do it this way. And I think on this one, you can see there's a little bit of an ulcer. So I was probably putting too much pressure on that tissue right there. So that's something I would see and then probably trim the temp a little bit. But it's really cool if you spend the time to make the temporaries basically perfect. When you put the final bridges in that are permanent, there's no adjusting to do. So it takes all the guesswork out of it. And then, so these were the final bridges. You can see they're a little bit shinier. I guess we finished everything before the lower left was done healing, but that's enough for her to chew on. And the resident behind me, I think, finished the lower left. So there she is. Okay, one final case. I think this one's the quickest. One thing you'll learn in dentistry is that a lower denture or anything lower movable just like absolutely sucks. There's no good way to get around it. It's just uncomfortable. Patients don't like them. So this patient came in to see us and he was like, I'm sick of my flipper. My teeth have to come out. I want to get some lower implants. So what we ended up doing, taking out all his bottom teeth, Same day we took out the bottom teeth, we placed 6 implants, two in the extraction sites, maybe, yeah, 2 in extraction sites, and then 4 in native bone. You can try to get them pretty parallel if you can. And then we had a denture ready to go, just in case we didn't get good stability on the implants, or if something didn't go well with surgery, he was going to wear a denture for healing. But luckily, all the implants went in well. And just like you guys saw earlier, we had these little temp cylinders that we screwed into the implants and had them come through the denture. And then this is a better picture of it. You add like this acrylic material that literally smells like the nail salon, and it tightens around the temp cylinders, and it connects the denture to the temp cylinders. And then when it's done setting, which takes about 5 or 10 minutes, you unscrew the whole thing. And what you're left with is like all these temp cylinders connected to the denture. So what we did is we put on copies of the implants. You can screw them in, and then we trimmed down the extra, it's called the flange of the denture. We trimmed it down so that it's not rubbing on the soft tissue at all. It just simply touches the implants, and then the patient can clean underneath. And so that's how you make an in-house like screw down denture. It's called a hybrid, and it's called an immediate load, or like teeth in a day. I do this in my office quite a bit now, and it's cool because I'll do 3D printed stuff to help me with it. But yeah, this is an example of that type of case. And patient came in on the left in the morning, and he went home on the right in the afternoon. So it is pretty cool what you can do with dentistry. And technically I'm a general dentist, but I'm doing stuff like this in my practice. So I think that's something to consider when you're picking, like, if you want to do specialty or not. If you get enough training in whatever you want to do, you can kind of do anything and pick and choose. So I guess advice, you guys told me to give advice out to people. These are all in caps because I think they're all really important. But the biggest thing is just be nice to people. My patients tell me all the time, like, I love coming to your office because you're nice and your staff is nice. Like, so many dentists get, I don't know, curmudgeonly. And I hope none of you get like that. And I hope you really love what you do and treat people like humans, because it's easy to treat them when you're busy and you're having a stressful day. It's easy to lose sight of that. So just be nice to everybody. Be honest. That's another thing that my patients give me feedback about. They're like, never had a dentist like tell it to me straight like you do. And it's a huge way to build trust with someone. If I'm doing something for the first time, I'll actually tell the patient that. I'll be like, so I've never tried it this way, but we can kind of experiment and see how it goes. And if it doesn't go well, we'll go to like plan B. A lot of times this is when there's no good option, right? And I'm like, okay, we'll try it. But if you just have an honest conversation with people, they respond so well to that. So I don't think it has to be quite as like professional, if you will. I think just talk to people and openly communicate with them. A lot of what I do in my practice too is I spend half of the consult like trying to talk patients out of treatment. I'll be like, this is why this is a terrible option. This is why you will hate it. But then when they don't hate it, it ends up working out really well. And they're like, oh, this is so much better than you said it would be. So that's been huge for me too, as far as a practice builder, as far as like patient management goes. I have never done this, but I do know people who have extracted the wrong teeth. So another thing that I always do in my practice is like triple check with the patient and the assistant and the chart and everything. Like, okay, we're extracting this tooth, it's this number. We double check in the mirror, because you don't want to extract the wrong tooth. It's a bad look. And then just have a lot of photos ready, have a lot of visuals ready, have a lot of analogies, because patients really respond well when they understand. And so many times I get patients who come in for second opinions with me, and if I sit down and simply explain like why we have to do something, they get it, and they're so much more willing to go through with the treatment. And so they'll say yes on the spot. It's just they never understood. So I think if you take time and like you can relate to them on their level, like I have a patient who's a bricklayer. And so we'll go through it as if it's his job. Like, okay, this is why teeth relate to your job. He gets it. And then we've now done his whole mouth. So I think just understand where people are coming from. That's another big thing that I would give you as a piece of advice. And that's pretty much it. I think that's the end of my slides.
Dr. Katie, thank you so much.
Yep.
So I see that there's a lot of questions. So Dia is going to go ahead and read some of them.
Okay.
Yes. I know you asked a few questions during the live. It was more about the case. I think there were two.
I lost her.
Yeah, I think she froze out.
Okay.
There we go.
Sorry. Yeah, my Wi-Fi is cutting off a little bit. Oh no, my Wi-Fi is really bad. Can you hear me now?
Yeah, I can hear you.
Okay. I'm sorry if it cuts off. But I can start with these questions. All right. So how did you plan and carry out the financial aspects of opening your own practice?
I took out a loan with Bank of America for 110% financing and got a great rate because of COVID. So when I signed up, my interest rate was like 4%. And then I kept emailing them every week. And I was like, yo, like other banks are dropping their rate because of COVID, like give me a better rate. And so I just took out, I think I took out like a $350,000 loan to get in all of my equipment and everything I needed. But it was all 100% financed plus working capital. So I just pay that off every month.
Got it. Someone also asked, how much can dentists expect to make after dental school?
It depends what state you're in. It depends. Did you go to residency? It depends how lucky you are. It depends on who you know. It depends on so many things. My first job, my first year after 3 years residency, I was offered $120,000, which after 3 years of residency wasn't like a ton, but I was also given a ton of flexibility to take 1 day a week to learn how to use a 3D printer and do certain things. So I think if you work on collections, it really depends, which a lot of dentists do, it depends on how much comes in that month. So a lot of dentists will make 35% of collections for the month. And that's actually how I pay myself at my own practice now. So it just depends like what's coming in. If you're getting a lot of cleanings, you're gonna make less money. If you're getting a lot of crowns, you're gonna make more money. But I would say average probably 100 to 200,000 your first year. And then after that, like it can stay like that, or some specialists make a ton. I don't even know. But they say that after $77,000 in income, everyone's happiness level is the same. So, we're all doing fine.
Yeah. All right. So the next question is, did you get paid during residency or fellowships? You said yes, right?
Yeah. So one of the reasons I loved my residency program was the highest paid in the country, which was fantastic. You don't make a ton as a resident, but it was enough to pay my bills. So I didn't have to go into debt in residency.
That's awesome.
And normally I wouldn't talk about money, but like you guys need to know this as, pre-dental. So this is important.
Yeah, for sure. Thank you so much for being so truthful and honest with this, because these are questions that are hard to ask dentists.
Yeah, and if anyone wants to ask me stuff offline, like I'll give you more specific stuff. I'm not shy.
Yeah, for sure. The next question is, how well did Columbia prepare you?
So I don't want to talk badly about my school. I loved it. But it prepared me really, really well for the medically complex patients, but not so much necessarily for clinical. It's another reason why I wanted to stay to do an additional 2 years for a fellowship, because I didn't feel like after 1 year of residency, I was ready to go out into the real world. That being said, some of my classmates were. So I think it was also just my personality. I was so scared to like do harm to patients in dental school that I wasn't probably doing as much as I could because I was so perfectionisty about everything. So you have to like make the best of wherever you go and just take advantage and set yourself up for success.
Yes, for sure. And then the next question is, how were your hours during residency or fellowship?
Oh, they were brutal the first year because I did a GPR where we took call, and I think I was on call like 50 plus times. So there were times when I worked like 36 hours straight. That was rare. Like usually you would sleep at least some of the night if you were on call, but it was cool. Like there was trauma coming in. I learned a ton by being on call. So if you guys are considering a residency of either doing call or not, like it sucks for that 1 year, but you learn so much and you get so much more comfortable treating like whatever walks into your office. So the hours were like 7:30 to 5, but then if you were on call, it was a 24-hour thing. That included weekends. But I mean, during the week when you weren't on call and weekends, it was fine because you're done by 5.
But were there always like other doctors next to you, just like in case you saw a case that you've never like really experienced and then you needed a little bit of help?
Yeah. So in clinic, yes. There was so much hand holding in residency. It was amazing because we had a ton of volunteer attendings and I would like pull them into the room and be like, please help me do this. When we were on call, in the beginning, we were paired together. And so there was always 2 of us. And then there was an oral surgery attending overseeing everything we did from afar. So we would like text them and like FaceTime them and like send them like videos of the comb beam because we had no idea how to read them. And they were all great. They would just like walk us through what to do. And a lot of learning dentistry is just doing. So I don't know, we got through it.
Yeah, for sure. The next one is, are you still paying for dental school debts?
Yes, everybody that I know is going to be paying for a while. So I am 6 years out. Most of my friends, I think, did like a 20-year. I'm a little different because I have a personal loan. So I didn't go through a bank. So my terms are a little bit different. I'm probably not a good person to ask about that. But most people are paying for like 10 to 20 years out, at least.
Got it. I think we already went over this case too. Is it an infection a big worry on this case? I think we already discussed that. Okay, the next one is, do you think dentistry is becoming too saturated and what are the prospects in the future?
Yes, none of you should become dentists so that I can have a monopoly. I'm just kidding. Is it becoming too saturated? No, it depends on where you want to live. If you want to move to big sky country, it's not saturated there. You'll make a shit ton of money. Like, don't move to New York. Don't move to Philadelphia. That's where it's saturated. Like, go somewhere where it's not. You'll make more money and you'll just be happier. So, it depends on the region.
Mm-hmm. Someone asked from the advice slide, how do you relieve stress?
Sometimes I pour myself a glass of wine. Sorry, I'm on vacation. I relieve stress by, I don't know, I have a ton of coping mechanisms at this point, but in dental school, a big thing for me was running or going to the gym. Now I go to therapy. So therapy is huge. Like you can go to talk therapy. No one talks about mental health, but like we're all type A people. If you're going to dental school, go to therapy, do yoga, hang out with friends. I don't watch TV, but like there's other stuff. I listen to music. I just am very good at deprogramming from work at this point, but I wasn't always like that. I used to take stuff home and dream about it. But now I'm getting better the older I get, like, okay, leave that at the office. And, think about other
Wait,
things.
so I know you're on vacation right now. Do you have like someone else like to take over, like whenever you want to take vacation or breaks?
So I don't have an associate, but I do have, my mentor is now my business partner. He's a dentist, but he doesn't practice anymore. But worst case scenario, he could like go in and see someone. I did just close my office for 10 days in February because I went to Hawaii, and everyone's fucked. I can still, I called in a script for somebody, not today, but when I was in Hawaii, I just sent in a script. I still post-op patients. Like I called a patient today. You can do stuff from afar, and patients get it. Like you can't be there 24/7. So you can close your office for a week. You just don't make any money that week, but whatever. Like,
I mean, you need that time off. Everyone needs that time off.
yeah, you need to recharge physically and mentally.
Yeah. Someone said, do you have any dentistry interview tips? I live in Canada. I have one interview. It's in 1 month and I'm feeling super anxious. General interview tips for dentistry.
Don't be anxious. Just be yourself. Interviewers just want to get to know you. It's all like at this point, once you get the interview, you're basically in the door. They just want to see that you're a nice person. So I would say the two biggest things would be smile and make eye contact. The interview is just to make sure that they could spend 4 years with you. Just be pleasant. And be who you are. Don't feel anxious. You're gonna do great.
Now it's even more weird because like you have to do it through Zoom.
Yeah.
A lot of the
Some of them. Now I think they're coming back to person, at least some of them.
Well, just practice do some mock interviews too. And I don't know, if you're that nervous, like take a shot. I'm kidding, but like kind of not.
Answers to everything. Kind of. All right. So the next question is, when you first got your first job after residency, how many days a week did you work? I know some dentists work 3 to 4 days a week.
I was working 4 clinical, and then 1 I had like a float day where I was just figuring out how to do certain things behind the scenes like tech, or I was learning about insurance. In residency, my 3rd year was part-time, where I was at the hospital 2.5 days a week and private practice 2 days a week, and then 1 Saturday a month. I have some friends that work 6 days a week, some friends that work 3 days a week. It's all however much you want to work.
One more is, what advice would you have told your pre-dental self?
I would have applied for more scholarships. I don't know why I didn't do that. I didn't realize how many were out there that weren't even through the school necessarily, but I mean, that can save you a ton of money. And also, Columbia offered a dual education program for free. You just like did the schoolwork and you didn't pay tuition for education. And I wish I'd done that. Like, why didn't I do that? I'm so mad at myself.
I have to check that out.
Yeah, so just take advantage of every opportunity.
Yeah.
So I think that's the last question, right?
Yeah, I think that's the last question. Well,
Awesome.
follow up to that. When you mean apply to different scholarships, that's not even in the school. You just mean like random scholarships, right? And then each specific school also has their own scholarships, right?
Yeah, exactly.
Okay, got it. Yep, that's all the questions we have for today.
Awesome. Thank you so much, Dr. Katie. I had a lot of fun, and I'm sure everyone else did.
Hopefully, yeah. If you ask questions after the fact, you can share like my email, my cell, whatever you want.
Yeah, guys, make sure to check out her Instagram if you have any other questions, any like personal questions. I'm sure she's gonna be honest with you, like she was with us. And yeah, thank you everyone for joining. Dia is gonna send the quiz in our YouTube chat, but it can also be found in our Linktree. And once again, Dr. Katie, thank you so much for joining. It was a pleasure having you. And I hope everyone